Okay, hello everybody. This is Dr. Josh Silver, and I have created a thing called the Toolkit that I wanted to show with you for how we can use this to help do better upper cervical analysis. And I created this out of a need that I found in my own practice. So this thing is called Toolkit, and when we open the application, it's open. You can see the bar here on top and the icon in the bottom. And the bar is basically all of the tools we use in our digital x-ray analysis created as an on-screen overlay. So you can have a horizontal angle tool that you can modify. You have a vertical angle tool that you can see where things are. We can text ourselves little notes if we want to. Main calculations is a very important thing in this program for the upper cervical doctor. And so we have different languages for different techniques, but they're all the same thing. This is for the EPIC technique. However, this is the language for the advanced orthogonal, orthospinology, or NUCA techniques. So I'm going to go with orthospinology and show you guys how we can use this to just literally plug in our measurements to get our measurements on any type of imaging we want. That will hide the tool and etc. So let's open up a cone beam scan, and I use Radiant as my preferred viewer just because it's pretty cheap and very versatile. And we're going to be doing an MPR analysis, which stands for multiplanar reconstruction. So when I hit this tab here and open 3D, I want you to think about each of these bars or lines as the direction of your x-ray. And so if you wanted to shoot an x-ray down the sagittal plane line of the atlas without head rotation, this is how you would do it. And when you position those, now we have a normal frontal looking x-ray. And the atlas is right there. That's how we would typically be assessing that. And so we're going to take the rules of traditional analysis and start to apply it to 3D and then measure things. To become familiar with Radiant, it's basically that there are the tools here, and when I click zoom with my left clicker, it applies that tool to my left click, so now I can zoom in or out. This is my contrast to change how bright things are. My move tool. The thicken tool, you'll see this little white button appear, and that will make things thicker or thinner, and you can do that on any plane you want. And a measurement tool, which is fairly straightforward. Holding shift will make this flat. And so what we're going to start with is just working from the list top to bottom. And the first thing we want is head tilt. And so how I do it is, we are going to position our image in Radiant, then we're going to open up the toolkit and measure. And then we click Radiant, and we're back in our positioning. So I take a fairly dynamic approach to this. I roughly position this for the center of the head. Right in the middle of the dens, right through the middle of those teeth. And that's my rough positioning. And I start up at the eyes. Right, I'm moving on this field to change it on another field. So if I move my sagittal up towards the eyes and I can see my orbits, I do this technique called dimensional transpositioning. I'm looking at one image on the frontal to try to reduce rotation on my horizontal. And as I roll through here, are the structures of the face appearing symmetrically or not? And I call this closing the orbits. But you can see how the left orbit closes before the right orbit closes. And the reason is because this blue line is not oriented correctly through my head rotation. So if I reorient it, now my orbit should close more symmetrical. And so I play with modifying the rotation of this pink line until, okay, now those eyes close together, closing the orbits. We scroll back, looking at all the features of the face. Are they closing and opening symmetrically? Right here you can see this is asymmetric. This floor, the sphenoid is opening here, and then it opens there. So there's maybe some internal skull rotation, but it looks like my jaws are also not coming into field equally. The right's appearing before the left. So I'm going to tinker with this again, and now I can get my jaws to appear slightly more symmetrical. We're really only changing the rotation 0.23 degrees at a time until we get this perfect. Last thing I check is the inner ears. All right, look at this eustachian tubes bilateral. Do they come in together? And they do. And once we've done this, I essentially consider this blue line my horizontal cephalic line. It's going right through the middle of my skull there. It's never to be rotated after that is done, and this image is never to be rotated or tilted. That is a very important rule. But once we have this blue line established, now we want to establish the head tilt line. So I'll take my image to the floor of the occiput, and I am looking for symmetry on my occipital floor. And as I scroll through this, it almost looks like I am seeing the left side disappearing before the right side. See that floor where the cerebellar tonsil lives is gone. I learned this technique from a colleague and friend of mine, Dr. Luchelinis, and he calls it Mickey Mouse here. You can see Mickey's head right there. So if I reorient this yellow tilt line just slightly, now that occipital floor closes more completely. These condyles appear and disappear symmetrically. And then I can scroll up all the way through the rest of the head. Do the jaws appear together? Those look really symmetrical as I scroll. And so I do more of this qualitative assessment to capture the skull's rotational point and the head tilt point. And if I double click here, it brings this one to full screen, and this is where we will pull up the toolkit, drop a vertical angle, and try to measure the amount of head tilt. The way I built these tools is that you can drag the points around and measure very quickly and easily. Okay. And it looks like her head is tilted to the right side by 0.56. So if we enter this into right 0.56, we have our first measurement of head tilt. And what the program is going to do is it will measure head tilt in any view you want, then measure the atlas plane in any view you want, and by comparing those together, we can calculate the laterality. Right now, we've assumed that the atlas plane line is 0, so since the head tilt's 0.56, it believes the laterality is 0.56. That will change when we get our next measurement. So, I would love to do atlas plane line next, but in this method, we actually have to do atlas rotation first. So to measure atlas rotation, I will reorient my film again down the atlas plane, flat, and that way as I'm coming down on my axial, I'm seeing it appear on both sides pretty symmetrically. The problem is that if we look here, it looks like the right side of her atlas appears in view before the left side does. And the reason this occurs is because you can see her atlas is high on the right. And so at this plane, we can only see the top of her atlas on the right. As we drop down, now we can see the atlas on both sides, but we're not looking through the same parts of the atlas. We're looking through a higher part on the left than the right. So to measure the atlas rotation, I actually take this yellow line on my frontal and match it up more to the atlas plane line. That way, when I start to measure my axial image, I'm not looking at different parts of the atlas, I'm looking at the same part of it. And this is a small detail, but it will change your measurements by up to 2 degrees, I've seen. So I scroll this till I find a place I'd like to measure, and I activate the toolkit, and we can clear all to knock that away. And the protractor tool comes in handy here. If I drop a protractor over this blue line, we've already established that that blue is going through the center of the skull. That's why we didn't want to move it, we wanted to save it. Now I can place a protractor on the posterior superior lateral mass of the atlas, and this one is measuring as a posterior atlas rotation on the left by 1.15 degrees. Now the way I built the calculator is it only likes to eat anteriors, so we just have to enter this in as a right anterior of 1.15, and if the laterality is on the left, it will flip it to a posterior. Right now it thinks it's a right laterality, so it's an anterior, but if we change it to a left laterality, it says posterior. Capiche? We can jump back to Radiant and check this at other views and see if this is still in agreement. And I actually kind of like doing that because sometimes it will change, and I try to pick the best points I can. Alt-Tab, you can scroll back and forth pretty quickly and measure this very succinctly. So I'm just going to stick with that measurement there. And the next thing we're going to do is our C2 measurement. So let's jump back to Radiant. This one's pretty quick. We just pull this up here till we can see C2 spinous, open the toolkit, and we're going to center point the dens. The center point tool, and I try to find the very middle of the dens. Now we jump back to Radiant, and we cannot move the image, but we can scroll down until we see C2 spinous. Alt-Tab back into the toolkit, and now I can take the protractor and measure the C2 spinous compared to the head rotation on more of the horizontal view, and her C2 spinous is rotated to her right side by 4.1 degrees. C2 spinous right, 4.1 degrees. And again, as we get our calculations, it auto-populates your final measurements for you. But what I love about this part of my analysis is that we're not measuring C2 rotation off of the frontal film. We actually get to measure it directly related to the center of the head on the horizontal view. And I think overall that gives us a more accurate assessment of C2 spinous rotation. Now we can begin our assessment of the atlas plane line. And so if we check the atlas up here, oftentimes the atlas is rotated, and we just measure that. How much was it rotated? 1 degree anterior on the right. And the problem now is that if I look here, I can see the top of the atlas, but it's not the same part of the atlas because it's rotated. And so I don't want to measure the plane line on here with the blue line oriented to the center of the skull. I want this oriented to the atlas. And to make a demonstration of this, we'll see if it changes. If we put a horizontal angle tool over the atlas at this point, where it's rotated looking at the skull head on, then what we'll do is change it so we're looking at more of the atlas head on. And oftentimes, again, the plane line will change. Alright, we see almost a 2 degree difference on that plane line, whether we're measuring the atlas looking at it head on, or whether we're measuring the atlas looking at it from the skull head on. I think it is more accurate to measure the plane line of the atlas head on. And for the traditional folks, I think that adding a little bit of thickness to this slice on my frontal, you can start to appreciate what we've classically seen. So, we have our image prepared. It's on the plane line. It's aligned to the rotation of the atlas. We see it there. We add just a little bit of thickness to it. We can zoom in on here before we measure our plane line. And just really finish preparing this image for measurement. And I think that's where I want to measure it. So I'm going to open up the toolkit again. And the way I've done this is pretty slick. If you do horizontal angle, we're going to place these points actually just a little bit out and over where we want to be measuring the atlas. And I have up-down keys. We'll drop it down onto the top of the atlas, and the side keys will rotate it. So I can kind of do this icing on the cake method, where I'm letting this line sit down on top of where I see that atlas. And we can do another one for the bottom. I'm going to put this over here, put this right over there, start moving it up. Looks like it's a little too tilted, so we can use the arrow keys to increase the tilt until we get a nice icing on the cake effect. Some people are going to prefer to do this in a single slice. Sometimes I often do it this way. And we can see, did we get good agreement on this line? Actually looks like that one needs to come down just a hair. And this one looks like it's consistent. Now what you can see here is that there's about a 0.7 degree difference between these atlas planes. And traditionally, we measure the atlas plane off of the posterior arch alone. So if you want to be traditional, you could just measure your posterior arch, and you would put that measurement into both of these boxes, the superior lateral mass box and the inferior lateral mass box. But in my perspective, I'm not really concerned what this posterior arch feature is doing when I'm trying to assess subluxation at the C0 joint and the C1, C2 joint. I'm more concerned about the shape of my atlas. And due to the high amount of aberrancies, you will always see a difference in these angles because this person's atlas is taller on the left side and shorter on the right side. And so the way I've designed this calculator is that you will use the superior lateral mass line, and hers is high on the right by 2.02, high on the right by 2.02, and the inferior one's high on the right by 2.71. And what the calculator will do is it will use this line to measure your upper angle, and that's why it's comparing these two together for upper angle, and it will use this line to compare it to your lower angle, and that's why you see a 2.71 there. It will average these two out to tell you what your working plane line is for your math and your setup. But I call this method the triple plane line method, and this is kind of how I'm doing it, if you wish to. We have now measured the plane line. We've measured quite a bit. We need our cervical spine tilt, our C over A, and then our wrap it up. Pretty quick little analysis if you just work your way down the chart. And I am showing you my method for doing this. I don't necessarily think this is the best method of doing it. And we continue to learn more as we use this technology and become more familiar with it. So we need to measure cervical spine tilt, and we can come back to our MPR radiant viewer. And to measure our spine tilt, I will take this blue line, pink line, and point it straight down the neck. I will add quite a bit of thickness for this slice. If we zoom out on our frontal, we start to see our cervical spine. But I also like to see this one with no head rotation, and that looks pretty good right there. So if we open this up and we crop our image till it's right where we want to start measuring our cervical spine tilt, we can move those out of the way. if we open up the toolkit, the center point tool, I'm actually going to see, maybe we can see a little bit better in pink. Close. Center point the dens. Center point the sides of C2. Center point the inside of the neural canal. Center point whatever you feel like center pointing. I just try to pick symmetrical parts of the vertebrae. I don't want to pick the bottom of the joints on both sides. I want to pick where they meet on both sides. I don't want to just pick a part up here and a random one down there. So we can Control Z that away. Vertical angle tool, I'm going to drop 1 point right over the center of my dens, 1 over the center of my cervical spine. It looks like I'm not really getting a good graph. I want it kind of going through a lot of these. So if we move it over here, now it's going through the middle. There's a couple X's on the left, a couple on the right. I just try to get an average plane of those. So this person's neck is tilted to the left by 3.03 degrees. We make sure we click cervical spine tilt left, 3.03 degrees. And that is that. Back to radiant, and we will prepare for our C over A view. So, it will take a little bit of practice to become familiar with these tools, but I like to show off how fast I am because I've been using it for a little while. And so, it's a pretty slick program to see what we're looking for. And so right here we can see a really nice view of those joints, and that seems like it'd be a fairly good place to measure. And in traditional, this is exactly how we measure, right down the plane line, and we would drop those in the dips. However, if we thicken this up a little bit, when we're actually looking down the plane line, we're not always looking flat over the top of C2. And what I mean by that is we can see that C1, C2 joint over there. But if I start to actually tilt this down, you'll see this joint start to open up or change. And the method I prefer is not to necessarily look at this and measure it down the plane line, but measure it where I see that C1, C2 joint most flat. And I actually feel like it's pretty much more there. It's usually you drop this plane line down about 10 to 15 degrees, and that is usually where I see that C2 joint flatten out. And that seems like a pretty good place to measure. Now, I do think that adding a little bit of thickness here makes some of these joints sometimes a little bit more consistent. So if I can see a nice flat condylar joint to measure, I'll do it with a thickness. If I can't, we'll do it flat. But it kind of changes it a little bit. What we're going to do is get this image totally ready to be measured, play with any type of shading you might want. The only thing that's super critical here is that we use the measure tool to drop a straight line. It has to be flat, so hold Shift key and drop it. It can be anywhere, any size. Just make sure it's not over the joints you're trying to measure. And we will open up the toolkit again. When I hit clear all, I need to calibrate this machine to measure the C over A. So we have this calibrate button here, and that's why we drew these lines, is that if we superimpose this line over these, I can teach the software that this length it's seeing is 2.26 centimeters. And we're going to need this reference in order to tell how big this circle is in inches. Now the condylar circle button is here and the axial circle button is here. When I hit C, you'll see that calibration saved. And we drop the 4 points. The first one is on the most lateral part of the joint at the occiput. And we really want to measure the weight-bearing surface of this, which is considered that lateral third of the joint. So I'm going to click it right there. We do the same thing on the other side. We start on the inside, and we drop another point further out on the outside. And what you see one green line, but if I tinker this, you start to see more. Right? We'll see 2 circles that are in red and 1 circle that's in green. See if it shows up on the axial circle. Okay. And so this is an automatic circle finder. As long as I have these points accurate, one of the red circles is going to go through the lateral portions of the joint on both sides and the internal point on one. So it's showing us really the condylar circle of this left side. And then the other red line or circle is showing the circle at this side of the joint. And the green one is an average between them. So the average condylar circle between all of these 4 points is a 3.81 condylar circle. And the axial, there's a bigger discrepancy between the left and right sides of the joint, which is why we see 2 different sized circles. But the average between them is a 5.61. That is how we measure our condylar axial circle with this. We can open up the main calculations box, and if we hit auto load, it will take our measurements and put them directly there. And there's our condylar axial circle. It looks like it actually put that in slightly wrong. That is a bug we'll fix. Okay. Now I have all the measurements I need, so I'm going to make sure I hit the Save Measurements box, and we can save all of these as ortho analysis, or whatever you want to call it. That is how we get all of the measurements with this tool. But we're not quite done. We still need to know where do we aim the machine, and I like to get a good picture for my report of findings. So when we come back to basic radiant, we can also open up the whole cone beam as a 3D file. And to quickly show you how we do this, we're going to see where's the skull look most roughly unrotated. Right there for her at -3 degrees of rotation, she's not rotated, which means at 177 degrees, she'll be getting a straight posterior to anterior view of her. That is a straight P-Day view at 177. So I'm going to go ahead and rotate this image with the arrow keys until I'm looking at more my plane line. And so now the atlas is superimposed there. And if we open up the toolkit and hide the calculations, I've got this nifty little show misalignment tool. And we will put this red line over our atlas. We will place this one over our head tilt. And we will place this dot over the bottom center of the neck to get a really nice report of findings picture of what's going on in her neck. I'm going to use my snipping tool, grab a picture of this, and save it for my report of findings. Back into Radiant we go, and we know from our analysis that this case is a right laterality, and we will be adjusting them on the right side. So, back into Radiant we go. Let's take a look at the right transverse process. And I like to match the jaw here, and what I mean by that is I see some jaw in the back and some over here. I want those to match up. So I do that to get them matched, and I also do it up and down to get the tilt out. See one jaw here, one jaw there. Let's crop a nice lateral shot of their skull. We're going to zoom in, and we can see her TP there on the right side. And if we open up the toolkit again, I like to use freehand tool in a level 2 thickness, and I like to circle that transverse process. But I also reference the jawline, and I also reference the mastoid. If we jump back into our Radiant viewer and click density, we do this until the earlobe and skin superimposes. And this bar is an artifact from the cone beam scan that we could have trimmed out if we wanted to. But when we open up the toolkit again, now we can see exactly where that transverse process is. It's right under your earlobe, like a little earring. And we have an external viewpoint reference of where to be aiming our adjustment. And we know exactly where that mastoid is in reference to it. I will use the snipping tool to grab all of this and save it for later. At this point, what I like to do is open up a Word document. And I like to look at it in a more of a layout setting. And I'm going to go ahead and drag and drop some of those screenshots we were taking. And we can go ahead and just put all of those into one place. You actually have to do position top right for one of them, position top left for this one, position bottom right, and then I'll just kind of orient this around until I've got my listing card. Now for me, I actually use Sonus Blueprint, and that document will calculate all of my vectors. So you see I've got all my measurements here, but when I'm adjusting people, let's see, where are they? This is the listing card I'm using. And so it will take all of my measurements and automatically pop them in and calculate the Z and Y of my adjustment and give me some reference of how bad they are compared to other patients I've seen, exactly what type of positioning would be best suited traditionally for a case like this. There's my mastoid and my posterior view. So I hope this is informative and kind of shows you how, like, with this toolkit, we can just really get through a lot of different measurements very quickly. The main calculations will add it all up for you, and depending on what technique you use, you can change it until it works for you. I really am passionate about this project, and I just found that when I was doing my analysis manually, it was taking me about 40 minutes to scan to get through it using many different tools on my computer, and now we're down to about 10 minutes to scan. Today we were teaching it took a little bit longer, and we're able to just help many more patients. So I hope this is informative, and you can get a demo of the toolkit at advoaccessories.com, and I hope to see you soon. Bye-bye.